Good evening, everyone. Allison Skalberg here, coming to you tonight from ADDA-SR, the Southern Region. This organization is an attention deficit organization. I've been leading this group, I don't know, I guess probably about 10 years. It's just kind of a side thing from a volunteer perspective. And we meet on the last Tuesday of most months. We do take a break during the summer, and we have different speakers each month, and we go from 6:30 to 7:30. So tonight, we have Dr. Bibi with us tonight, and she's going to be talking about the benefits of genetic testing as it relates to medications for ADHD and quite honestly, a lot of other kind of the mental health realm. So she's going to be talking to us about that. Tonight's webinar is being recorded. It will be on our podcast later. Everybody that is registered for tonight's webinar is going to get a copy of the slides and also a link to the recording tomorrow. Also in that email, you're going to get more information about joining ADDA-SR. Pam Esser founded this organization back in 1987, almost 40 years ago. Because she found the need for parents and people alike to have help and resources as it relates to ADD, ADHD. I think they all put it under the umbrella of ADHD nowadays, of inattentive or hyperactive or what have you. But some of us old school remember all of the old names that they threw around. So we are a parent group. We are domiciled in Texas. We have people join from all across the U.S., not just here, but we're a parent group. So most of the people that join us for these meetings are parents who have a loved one, or maybe they're a caregiver for someone who has ADHD. And we have different speakers each month. The benefit of joining ADDA-SR is, number one, it's super cheap. I think it's like $40 a year. It's cheap. It might even be 20, I'm not sure. But they do have an annual conference that's very beneficial, and they bring speakers in from all across the United States that are very valuable. And so our chapter actually meets online. We do not meet in person anymore. We stopped meeting in person back in 2020. But there are other groups for adults and for other folks all across Texas. So if you're looking for a group that meets in person, you can reach out to Pam Esser, and she'll be able to point you in the right direction for the group that might be near you. So having said that, I just want to go over a couple of housekeeping items. Tonight we are in webinar mode, which means that we can't see you or hear you, but we do know you're here. We're glad you're here. We're going for an hour tonight. We invite you to put your questions in the chat box. I'll be monitoring the chat box for Dr. Bibi tonight, and we'll get to as many questions as we can during the time that we have together. So having said that, Dr. Bibi, welcome. We are certainly glad that you are here, and I'm going to turn everything over to you.
Awesome. Thank you so much, Allison. And it is a pleasure to be here. Welcome, everyone. Today, we'll be talking about an exciting and growing area in ADHD care, which is pharmacogenetic testing. And so whether your child is currently on medication, just starting, or if you're unsure about the next step, this session really will give you tools to make more informed and personalized decisions. And for those of you who stay till the end, I have a special gift for you because you've just taken a powerful step towards supporting your child's health and happiness. And by being here, I just want you to know that you're not alone on this journey, and I'm here to help you every step of the way. So at this point, I also want to state that, your healthcare provider is your support system. And really, whenever you're making decisions when it comes to medication therapy, it's important to carry your healthcare provider along and consult with them. And so the topic that we're discussing today is an approach that empowers parents to make informed choices for their children with ADHD. By tailoring treatments based on individual genetics. So really what it does is it simplifies the complex trial and error process of finding the right medication. So let's discuss how this personalized strategy can positively impact the lives of children and families that deal with ADHD. But before we go into that, I do want to share a little bit about myself. Take a moment to introduce. My name is Dr. Bibi Ladipo Ajayi. I'm a passionate professional. So that would be the slide before this one. Um, and I'm dedicated to the fields of pharmaceutical sciences and mental and behavioral health therapy. I consider myself a caregiver to caregivers. I truly understand the significant impact of ADHD and how it can have a significant effect on individuals and their families. So I just want to share a little bit about my expertise and give you a little glimpse of my journey. I have a doctorate degree in pharmaceutical sciences. I've been a pharmacist for over 15 years. I also have a master's in marriage and family therapy. And in my current position as an associate director of scientific content, my role really is to ensure that information that's provided to healthcare providers is accurate and easy to understand so that physicians can make informed decisions about their patients' medication therapy. And then as a therapist, I have the honor of assisting people of all ages in navigating challenges such as trauma, PTSD, and ADHD. And really, at the heart of my work, really is a commitment to nurturing relationships and empowering families. I consider my family my people, and there's a picture of them right here. Um, and really, this is the same way that I feel about the people that I work with or that I help support. Supporting families through the ADHD journey isn't just what I do, it really is kind of who I am. And for me, this mission didn't just begin in a clinic or a classroom, but really in my own family. My brother has two incredible sons. They're both diagnosed with autism and ADHD. And I've really watched firsthand what it means to face the unknown, to ride the emotional highs and lows, and to keep showing up every single day for a child that you love more than anything. One of my nephews was completely nonverbal, and I really remember the silence, the frustration, the moments when words just would not come. But I also remember the joy, the breakthrough, when after consistent, and note this word, it's multi-layered support. Um, because a lot of times it's not just one thing, right? He began to speak, and that moment really changed him. It changed our entire family. It taught me that there's never just one answer when it comes to ADHD or autism, that no single strategy or medication is a magic fix. But when we approach it like a puzzle, which is carefully, compassionately, and with persistence, amazing things start to happen. And that's really what drives me, helping parents and caregivers piece together that puzzle. So
Um,
whether it's exploring new tools like pharmacogenetic testing, uncovering natural supports like neurofeedback, or simply creating a space where parents can feel seen and understood, I believe that every step forward matters. And I've really learned that thriving with ADHD isn't about fixing a child, it's about uncovering what works for them, what soothes them, what strengthens them, and what really helps them shine.
for
And
those of
oh,
us that are
yes.
on here that maybe have someone that is nonverbal, that's a
Mhm.
powerful story that you told about your nephew. How old was he when he started to speak? I'm just curious.
That's a great question. So nonverbal, but until with all the things, he started speaking when he was 4-ish. Yeah, is when he started making those really clear statements.
That's exciting. And before we
Yeah.
get into the content, one of the things I would say on my own journey that I learned about this testing probably 10 years into my own journey with one of my kids. And it is perplexing to me why this isn't the law. Before we prescribe these medications that could be harmful, some are great and some are not. It just depends on that individual. It just seems like it seems so crazy that this just isn't the law before we start doling out medications, because I will tell you that ours was shocking. We were, doing medication, and we were seeing increased anger and just rage even.
Mm.
And
Awesome.
as we found out that my child really was allergic to the medication that she was on. So it was a kind of a matter of turning the knobs, but it was like eye-opening to me, to be 10 years down the road with this and find this. So I can't wait for people to hear what you have to say.
Yes, no, absolutely. And there's so much advocacy around this, and really not just for ADHD alone or even mental health conditions. It's really across the board. The applications are so mind-blowing and just how effective it can be at reducing those side effects. I mean, a lot of people currently have kidney failure or liver failure because they're exposed to certain, medications that if we had a genetic test for that, the reports from, pharmacogenetic tests, that probably would not have happened, right? It would have allowed for guided decision making when it came to the medications to choose. So I totally understand what you're saying, and can relate to that. Um, but there's been progress, so there's hope. I think it's becoming more streamlined these days than it was, in a few years back. So just kind of wrapping up just about myself, really. Um, like I said, I learned that it's not about fixing a child. It's about uncovering what works for each child. And so if you're here, you might be uncertain, maybe exhausted. And then there's people who are really hopeful, right? You're in the right place. And, I'm just honored to be able to support you on this journey, okay? Because I've seen what's possible and I believe in what's possible for your child too. So let's jump into what we're going to talk about today. That's the right slide. So we're all familiar with presentations of ADD, ADHD. Now, according to DSM-5 criteria, at least six symptoms of inattention, hyperactivity, or both before the age of 12 and in two or more settings are required for the diagnosis of ADHD. But we also know that this presents uniquely from one person to the next, right? And this is really due to several factors, such as an individual's genetics, like we're talking about, epigenetics, environmental factors and stressors, and interactions between genes and nutrition. So, for example, a recent study showed that children with ADHD, or children in an ADHD group, were significantly more likely to lack vitamin D than the other group without ADHD. Vitamin D has also been reported to affect brain growth, and act as a immune modulator for behavioral disorders. It's essential to produce the neurotransmitters that you might be familiar with, dopamine and norepinephrine, which help alleviate the symptoms of ADHD. And I could go on and on about other nutrients that have been found to be deficient in people with ADHD, but that's not the focus of our discussion today. So in the future, I plan to host a webinar that goes into detail around micronutrient testing and supplementation and how that can help improve the ADHD journey. So what does traditional ADHD treatment look like, right? It usually involves, a combination of behavioral therapy and medications. And finding the right medication can be very complex. It can be a complex trial and error process, and really challenging, not just for the individual, but just even for the family. We can go on to the next slide, please. So current medications for ADHD include the use of stimulants like methylphenidate, and many of you are familiar with that for those who are on some kind of therapy, and amphetamines like Ritalin, Focalin, Adderall. And stimulants are usually associated with short-term adverse effects, such as decreased appetite, weight loss, insomnia, abdominal pain, headaches, and anxiety. Um, and the risk of dependency or substance use disorders. So that's pretty much a big deal. But a lot of that substance use and just dependency mostly happens, more so as a child kind of moves into the teenage years and adulthood. Now, there are also non-stimulants like Strattera and Qelbree, with the most common side effects of increased risk of seizures. And finally, there's antidepressants. Because as I mentioned earlier, some of the symptoms associated with ADHD have a lot to do with the levels of neurotransmitters in the body, which affect our moods, right? So it's not unusual to find an antidepressant as well as a stimulant on the medication list, especially when there are co-occurring conditions like anxiety and depression. Um, and then depending on the individual, these medications are associated with reasonably good efficacy of around 60 to 80%. Now, approximately 20 to 40% of patients with ADHD either respond poorly to the current treatments or they suffer from medication side effects, like the ones that are listed here under common side effects. So it's not uncommon for individuals to experience high blood pressure where they didn't have any of that, no history of that. There's headaches, as I mentioned earlier, decreased appetite, insomnia, behavioral rebound, right? So it seems like they're doing well, but all of a sudden it just kind of switches and back to maybe even worse behaviors than, aggression and just rage and all of that. Then depression, suicidal thoughts, growth delay, and irregular heartbeats or rhythm. And so those are some very common side effects that are experienced by patients who are on ADHD medications. And so while the use of ADHD medications can be changing, rather, many families find this process really stressful, right? It can feel like a guessing game. Some children experience great results right away, while others go through several medications and different types of doses until they find a good one, but really with a lot of frustrating side effects. And this is where pharmacogenetic testing comes in. It really can help take the guesswork out of the treatment process. Next slide, please. All right. So, when it comes to understanding your child's unique needs, it's really crucial to recognize that children can respond to ADHD medications in many different ways. And this variability means that what works for one child may not work for another. And when it comes to side effects, genetics does play a significant role in how children experience the side effects from medications. I want you to just keep this in mind. One size does not fit all. I'm speaking on the previous slide, but that's fine. I'm almost done there. It's essential to tailor the approach to your child's unique makeup and response. And it's also important to understand this critical truth because it really can lead to more effective treatment plans and ultimately better outcomes for your child. Okay, thank you. All right, so let's go deeper into this world of pharmacogenetics and really how it relates to ADHD medication. Pharmacogenetic testing really examines your child's DNA to predict how they will metabolize and respond to different medications. And what this means is that we can identify the effective medications and dosing while minimizing side effects. And so doing this, we really reduce the guesswork in treatment plans and allow for a more tailored, personalized approach. So I want you to imagine not having to go through multiple medications and dosages to find what works. This pharmacogenetic testing can truly streamline the process and it makes it more efficient for both the child and really the entire family. It's important to remember, especially as we discussed earlier, that each child is unique, right? So what works for one may not work for another. Pharmacogenetic testing can help us navigate these complexities with greater accuracy. All right, and it once again, it really is a simple cheek swab that tells us how your child's genes might affect their response to certain medications. It focuses on how the body processes medication, whether it does it slowly, quickly, or just right. And this knowledge is really what can help your doctor personalize the type of medicine and the right dose for your child. And when it comes to the body and how it processes medicine, it usually uses enzymes to break medications down. And how well these enzymes work can really affect how you respond to medicine. And this test tells us if you're one of these types of metabolizers listed here. There's fast, rapid, ultra rapid, metabolizers. And in the situation where we find out that a child is a fast, rapid metabolizer, what happens is that they process medications swiftly. And this is good to know because that influences how we prescribe the dosing and all of that. Then intermediate, they might require adjusted doses due to their reduced ability to process drugs effectively. For slow or poor metabolizers, this is usually where you have a lot of issues because this group can struggle significantly with medications, often leading to more side effects, which is why understanding their genetic profile is crucial. And then finally, normal extensive metabolizers, they process medications as expected, but knowing this also helps us to confirm the treatment path, right? So we're not just throwing everything at the kitchen sink. Now, understanding these categories, like I said, helps us to tailor our approach, ensuring that each child receives the most effective treatment with the least risk of adverse reactions. Okay. It cuts out that frustrating trial and error process that many families have to face. And even just really for your healthcare provider that doesn't want you constantly coming to their office because nothing that they're recommending is working, right? It just really is a solution that, works for everyone. All right. So next I just want to wrap up with what are the benefits, right? How does this transform ADHD and ADD treatment? First, personalized treatment is key, right? Tailoring medication selection to a child's genetic profile can optimize the chances of success, less guesswork, more effective solutions. And then effectiveness, right? We know that we're hitting the target. So it increases the success rates and reduces the stressful trial and error process. And you keep hearing me use the word trial and error process. For some people who've experienced this, they know exactly what I'm talking about. But I also just want, people who are considering medication therapy to really understand that this can be a really gruesome process, and it doesn't have to be. We can't overlook the reduced risk of side effects, right? The testing does help identify potential adverse reactions, which allows for safer medication choices and ultimately leads to a better experience for the child and for their family, right? It's a whole journey. And it's just always better to kind of start off right when you do decide to go that route of medication therapy, or if you're already on it, but just to optimize it.
Do you
So
have a
finally, these,
preference,
oh, go ahead.
as it relates to, like if the child is already in school, med changes could be a game changer in a negative way. It could be positive. Like, I know a lot of the kids are out of school or they're about to be out of school shortly. So if a parent is looking for med changes, do you feel like a trial during the summer is a good time to do that?
I would highly suggest that because, yes, a lot of these medications, when it comes to just the way they work and their therapeutic window, kind of transitioning between one or the next, or even between doses, can really have a dramatic shift, right? And so, yes, times when they don't need to be, say for instance, it's a medication that's mostly focused on helping them with, focus, for instance, and they have exams coming through. You really don't want to disrupt that process, especially if it is, yes, they may be having, dealing with certain side effects, but it always is a benefit versus risk type of conversation that you'll have with your healthcare provider. At this time, is it more effective or just efficient to like keep them on it until we have a better time to transition them off of it? Because some of these medications have to go through a transition, and cutting them abruptly might not be the best thing. And so, yes, you're right. I would say, starting to explore the options before summer, but then maybe making the actual change, during the summer is always recommended. So you could do the test, but not actually make the switch until a little later, if that makes sense. Okay. So just moving on there, once again, this is very beneficial for, children who've had previous drug reactions, family history of drug reactions, so when maybe even just one person in the family, a parent, is very sensitive to medications, a lot of times you'll find that, to be consistent even in a child. But people who have chemical sensitivities, multiple health issues, and just on, a long list of medications and just are prone to organ damage, definitely this is beneficial for them. Um, and like I said earlier, I think I was talking about the cost and time efficiency, right? Cutting down on just how much, all that trial and error, right? It contributes to cost and time efficiency. You're saving time, avoiding unnecessary expenses on ineffective treatments. We're not just enhancing care, we're actually supporting, families in their healthcare journey with pharmacogenetic testing. So let's move on to the next slide. So it's really simple. The test itself is super easy. It's just a cheek swab that done at home or in your provider's office. The sample is sent to a lab. The results typically come back within a week, maybe 5 to 10 days, within that range. The report will include details about your child's body, and how they metabolize certain medications and which medications might be better suited. So there'll be even recommendations in a portion of it to say, and then maybe dosing recommendations, and or what if the medication needs to be avoided altogether. So that's what the healthcare provider gets to see and make an informed decision on. And so I just wanted to quickly share just some real stories that highlight the impact of pharmacogenetic testing. First, we have Sarah, and these are not real names, but this is a client who struggled with severe side effects and finally found relief with the right medication after testing revealed that she was a poor metabolizer. And really, she was resistant to stimulants, like a whole class of them. And so her provider switched her to a better suited option, and the difference was like night and day. This really shows how understanding genetic responses can lead to a more effective treatment plan. And then with Mike here, he was able to just avoid severe side effects thanks to the insights that we gained from his genetic testing report. And there's just better quality of life if you don't have to deal with things you don't have to deal with, because it's more preventative, right? You're not even getting into that because this whole process can really be, stressful for the child, but also for the family, like I mentioned. And finally, I want to just share, some feedback. Um, the empowerment that this family felt just from having this almost like a tool, it's like a tool in your toolbox to say, okay, this is information I know. Oh, the doctor's trying to place me on this, place my child on this medication. Well, based on the report, this is what, a report says to avoid or to be careful about. That just gives you a lot more confidence, right? When you're going into making these kinds of decisions. So it can empower families in their treatment decisions, and it's all worth it in that
I
case.
I felt like the report was really helpful. The report that I got was kind of, I'll use the term like red light, yellow light, green light. Red light, you
Mm-hmm.
should totally stay away from. Yellow, proceed
Yes.
with caution. Green, your kid should be good on this med. And it
Mm-hmm.
wasn't just the ADHD meds that it tested. It tests everything, all of those antidepressants,
Mm-hmm.
antipsychotics, the
Yeah.
anxiety, depression, you name it, all of the mental health alphabet soup that we throw around. It
Mm-hmm.
tests all of those medicines.
Yeah.
And I think that that's really, really important. And also, just like any kind of genetic predisposition of their body not making something that's critical
Mm-hmm.
for mental health, which we can see as well. But what I want to ask you, Dr. Beebe, so, it's not your average run-of-the-mill provider that provides this service.
Mm-hmm.
I have found that psychologists sometimes, psychiatrists usually offer this. And what I found is you have to ask because they don't offer it.
Mm-hmm.
But so tell people if they're thinking, yes, I need to do this, where can they get that done? And then, and isn't it true that once you get it done, it's done because it's their saliva. It's not like you have to keep repeating this and it's going to change over time. It's kind of a line in the sand and it's good for forever, right?
Exactly. Yeah, no, you're absolutely right. So I'll address the portion of, yeah, it's your genes technically don't change, right? It's your genes. That's what you were dealt with. Now, how I guess your attributes manifest or how, what's happening in your life is not always going to be what, your genes, what's predicted, right? If that makes sense. But technically, it's a one and done test. It's not something you have to do multiple times, right? And it really just shows those predispositions based on your genetic profile. I like to describe it this way. I tell people, I say your genes and your gene report really, I mean, your genes are really like a loaded gun, right? So yes, you may be predisposed because of, your genes are really a mix of your father and your mother's genes. And so they might, someone may have had high blood pressure or diabetes, right? And maybe your genes are showing, yes, you have a likelihood of that. But what you really do in your life, is really what, the habits like foods that you eat, exposure to environmental factors and stressors and different things, how you take care of yourself is really what determines whether that trigger is pulled on that gun, like I talked about earlier. So if everything you're doing around your life and environmentally, you're eating right, you're doing all the things, taking the nutrients that your cells need, that trigger is not gonna it's not gonna go off. The gun is not gonna go off. But if you're stressed out, if there's so many issues, all the crazy things, yeah, that it will most likely lead down that road of, oh, my dad had this, and hey, they said I did, and it's because of more so the things we're doing. So because your father had a certain condition doesn't automatically mean you'll have it. And I think that's so empowering because now it's like I have the power to make this what I want it to be. My health journey can look like what I want it to be, and I'm not stuck with, a predisposition, if that makes sense. And so but having the pharmacogenetic test is good because it gives you all of that information. Now, I do need to let you know that, this is an evolving space in science. And so not all the medications are on that list of, what's tested. Now, most of the classes are. So you can make deductions and say like, okay, because this class of drugs, there's issues and there's, side effects that this person will most likely have. Let's stay away from that whole class, right? Even though the particular drug is not listed in that report. So, and this is something that's growing. So up until now, it wasn't so robust, but they're constantly adding to the list of medications and that's being tested. And obviously, as new medications are being launched and, manufactured, they will add to that. So that's the only thing, but you still don't need to do an additional test. Your genes can be kind of run again, almost so somewhat, and just kind of generating a new report based on that information, if that
Well,
makes sense.
well, one of the mind-blowing things to me and why we don't everybody do this once before medication is A, my insurance company paid for it for one kid, and B, if you don't have insurance, the out-of-pocket cost of it is like 300 or 350 one time. It's not like you're spending thousands of dollars.
Yeah.
And to me, it's valuable information to decrease the level of stress and all of the other things that can happen with the wrong medications,
Yeah.
and some of the things that you were talking about earlier. So
Yeah.
the second part of the question was like, where can they get this? How do they seek this information? Maybe
Yeah,
you have
so
a
like
slide
you
for
rightly
that.
said, it's not mainstream, traditional healthcare providers don't like offer it, right? And a lot of that is because they're not necessarily trained. You kind of have to get like a specialty training to kind of understand it, understand how to interpret it. But a lot of companies these days actually have almost like a support department that handles like the clinical portion where they will do a consultation and things like that. But really, there, like you said, there are providers, there are pharmacists who have like specific pharmacogenetic testing training where they can, and I think pharmacists are so pivotal, important for this role because of our background in medication therapy, in general, knowing how to find the information and validate the information, but also knowing how to simplify it for understanding and really understand how to do the dose adjustments that need to be done per patient or per client. So there are pharmacists that, actually offer it on a consulting basis, like they do it, in their own practice, almost like a private practice consultancy. I offer that, in my practice as well, alongside, all the things that I do. But yeah, those are some of the ways that you can gain access to it. Now, if insurance is going to cover it, a lot of times the doctor, the healthcare provider has to deem it medically necessary, and they can, because if you've been having a lot of issues, and this is what you can go on to the next slide, kind of talks about is, just the different situations that can cause insurance to cover it, right? And so that's an option as well. And then some companies actually provide financial assistance, right? They have certain conditions that you can meet to actually have it, paid for to some extent. So paying a reduced amount. But like you rightly said, the cost ranges from $300 to about $500, and that depends on how extensive the report is. So now the more streamlined ones that are like just focused on, mental health might be a little less, but then there's the robust ones that really cover all kinds of medications. So you're able to kind of see like blood pressure in case that's something that you need, but you can always refer to it. And like you rightly said, it is an investment, that's how I see it. Even if you're having to come out of pocket for it, but it's a worthy investment because it just sits in, it's one of your tools that you can always utilize no matter what stage you are in life and kind of what's going on in your life in terms of your health. Okay. I hope that answers that question. Okay. All right. So the other thing I wanted to touch on when it comes to, questions privacy wise, companies that are involved and that produce or manufacture these tests and actually send them out to clients must follow HIPAA regulations to protect sensitive information. So if you're curious, you can actually ask for detailed privacy policies, and they are required to provide that to you. So if that's a concern about like what's going to happen to my information, my child's genetic data, that's one thing that you could do. And then cost, like I mentioned, $300 to about $500. Insurance may cover it depending on medical necessity. And once again, it's a straightforward process, non-invasive cheek swab. Results come back to you 5 to 10 days. And yeah, just the decisions are made based on what comes through. Now, while no test is perfect, the report actually offers a highly useful layer of insight when combined with your doctor's clinical judgment. So it's pretty much a win-win for you, no matter what.
Are you
Okay.
aware of any of these companies that sell the information? I think as consumers, we've all heard the 23andMe stuff. Um,
Yes.
it's been in the news over the last couple of months. Are you aware of any that do sell information?
Well, I mean, it's all I mean, it's news, and you don't, it's some of it is speculation, some of it is actual, and then I think so the more scientific companies, typically you won't find that that's happening with them. It's more how do you describe them? Like more the marketing type, commercial type companies where research isn't their thing, they're just like, trying to sell. That's kind of, and you can kind of feel that when you're going through their website, like these guys are dedicated to the science of it. They're connected to a cause, deprescribing, those kinds of things. Those are the sources I would go to, to get information, but even also kind of use. And as a practitioner, one of the things that I do is I vet the companies that I use. I have probably about three that I will use, depending on what I'm trying to test, pharmacogenetic or just nutri-genetic testing, which is another, type of testing. But that's part of what I do is vet that and make sure that, they don't deal with all those things and they don't engage in selling privacy information.
One thing
GeneSight,
that
is
I think
one
is,
really good company. And
did
that's,
you say Gene
mental
Site?
health is one of their focuses. What you were saying?
Did you say Gene Site?
GeneSight, yes.
Yeah, that
Gene
was the one that I've used, and I had a great experience with
with
them, but
them.
I was curious if you had particular companies. But one thing that you said that I think is important, and I want to mention it again, is these results come back fast. Ours was less than 10 days. So usually when you do a test that you think it's going to take a while, this is a
Mhm.
forever process. This is pretty speedy. So when
Mhm.
you're trying to make decisions and you're working with your clinician and that kind of thing, they get the results fast. So
Yeah.
that is an important factor.
Yeah, no, it is. It is. You're not having to wait for a long time. They're super quick with turning that around and having a really actionable report that you can use to make, you alongside your healthcare provider can use to make decisions. So really good. And it's really, like I said, it's been an evolving field, and so it's better than it was 10 years ago, and even now. So yeah. All right. So you've done an awesome job sticking with me so far. Once again, I truly appreciate it. And as promised, I promised this earlier when everyone hopped on. Here's a QR code to access a printable parent's guide to managing ADHD medication side effects. ADHD meds are highly effective, like we've talked about, but the side effects can make the journey stressful. And these days, we're so inundated with so much information. This is where my expertise comes in. I've validated, collated these highly impactful strategies in a very concise and actionable format just for you. And this guide will help you feel more confident and informed because it has expert-backed strategies to navigate challenges with ADHD medication therapy. And really, this guide is for you if you're a parent exploring ADHD meds for the first time, if you're a caregiver of kids that's already on a treatment plan, and then, also for families that are considering alternatives like pharmacogenetic testing or current neurofeedback rather. Um, but yeah, that's the QR code, and you'll get that. I believe a copy of the slides is going to be sent to you, so you'll have access to that for later. And so I just wanted to give a teaser. This is just another thing that's next in ADHD care. For those who are interested in non-medication options, don't miss part two of this series. So I'll be back, I believe it's in August. Just, as school gets back in for kids, we'll be exploring microcurrent neurofeedback. It's a safe and non-invasive therapy that helps calm the brainwave activity and improves attention naturally. So it's a great complement to everything that we've talked about today. Medication therapy typically focuses on chemical imbalances, but this targets electrical imbalances. And ADHD is often linked to irregular brainwave activity, which disrupts the communication between neural pathways. And so microcurrent neurofeedback targets electrical imbalances and promotes the natural self-regulation without altering brain chemistry. And so, I mean, one of the, I guess, dramatic changes that happens with a lot of my clients just after one session of a neurofeedback session is like for those who have insomnia, like literally this is almost a constant. They're able to sleep through the night for the first time in months just from one session, So all the brain waves are important, but a lot of times we have like an imbalance in those brain waves. And so what this helps to do is to kind of shift us out of that sympathetic, imbalanced um, ecosystem of with our brain waves into a more parasympathetic, just calm state. Your body knows what to do, when it needs to, and it sustains that over time with, multiple treatments. So I'm excited to share about that later on. In August. So I would love to have you all back again. And this is how to contact with me or connect with me. That QR code has like links to my website, to there's my email right there, and just ways to reach out. So thank you.
Do you mind mentioning, I know you mentioned GeneSight, and I know they have a good website. I've looked at their website
Mhm.
before. Do you mind mentioning, you said you had two or three companies that you prefer. Do you mind mentioning the names of those other companies so people that are taking notes, they can write that down when they're
Yeah,
checking
absolutely.
on this?
There's also DNA Life is another one. So DNA Life that I use. And then this one mostly is not pharmacogenetics. They did at one time have it. I think they pulled it off. It's MBX, N as in Nancy, B, X as in X-ray, wellness. Gene site, no, there's, I think I see a chat there. It's GENESIGHT. I believe that's what it is. So like insight. So gene and insight, if that makes sense.
And where are you located, and are you accepting new patients, or what is your status?
Yeah, I am, open for, consultations. Really, I like to kind of talk to my clients before we, decide on like what really is needed. Because, yes, genetic testing is an option, but based on kind of gathering information and learning what's going on, I may have like, another recommendation that might even be a preference, So, but yes, my office is located in the Woodlands area. And that's north of Houston. And it's actually off of 45 and Gladstone. And my address is on the website as well. But like I said, it's always good to kind of do a consultation. I have my calendar open, and people can book to connect with me. We can have a conversation and then kind of go from there. Um, and then, yeah, I hope that answers that.
This is all really wonderful information. And I think, you said something at the beginning. It's like we're not trying to fix this individual or this child. As parents, I have often said we're on the relentless pursuit of information of how to help them live their best life and be the
Mhm.
best that they can be. And so I think this is helpful. Like I said, when I found this, I was shocked. I'm like, have I been living under a rock? How did I not know that this existed out there? And I just
Mhm.
think it's for the betterment of all individuals that are taking these types of medicine. It's not whether you're, for or against, I know that there's different schools of thought of for or against medicine, but it's really
Mhm.
what's in the best interest of the individual. And it can
Yes.
be just as much of a disservice to not be on medicine and need it versus the other, so it
Yeah.
can go both ways, but I think it is a slippery slope in trying to find that right fit for
Mhm.
that person. So this is very timely, and I
Mhm.
know that a lot of people have gone down that highway with medicine, the never-ending highway of medicines that aren't working, or it fixed this but it caused these other three negative things. you know
Mhm.
so those are real issues, so we are definitely appreciative of the knowledge that you've shared. Guys, check out her website and go to this QR code. It'll take you out there, and we are looking forward to partnering with you again in August to go take a deeper dive into the microcurrent neurofeedback that you were talking about. So
Mm.
exciting research is happening, and there are new options out there. So thank you so much.
Of
Well, it's
course.
certainly been our pleasure being here with all of you tonight. Thank you guys for your questions that you guys have put in the chat box. And I think this is May. I'm not sure if we're meeting in June or not, but we'll put an email out there. Everybody who signed up for tonight's webinar is going to get a copy of the slides and a link to the recording. It'll come out tomorrow. And then the
Mhm.
recording will live on our YouTube channel. That'll be on the Consolidated Planning Group YouTube channel. But check out ADDA SR and joining that organization, because there is lots of great information out there for families that need help. It certainly is. So thanks so
Yeah.
much, Dr. Bibi, and we'll look forward to seeing you again in August.
Thank you very much. It's such a pleasure. I appreciate this opportunity and, to share. Like you said, there's information, there's help, there's alternatives, and it's really just finding what works best. So, yes, I'm
For
happy to be
sure.
here. Thank you.
Well, thanks everyone. Have a great evening. Take care.
Thanks.